Hi, Dave Butler here with Align Therapy. I wanted to talk today about post-operative rehab for scoliosis and kyphosis correction surgery. This is something that is near and dear to my heart because I see a lot of patients before and after scoliosis and kyphosis correction surgery. And it's interesting that the vast majority of patients after those surgeries are not referred to physical therapy. And I think there are a few reasons why, but I wanted to talk about something that we have been developing over the last few months that will be helpful. If you're watching this and you have had scoliosis or kyphosis correction surgery, hopefully this is helpful. We have some good resources for you, and I'll put those in the description below. So check those out, and don't forget to subscribe to the channel so that you can be updated on other things that we're doing related to surgery as well as just kyphosis and scoliosis. So let's talk a little bit about why patients aren't referred to physical therapy after scoliosis and kyphosis correction surgery. If we have an adult who has like a single level or a double level fusion of their lumbar spine, it's almost without exception they're referred to physical therapy to get stronger and return to activity. With scoliosis, where we're fusing usually like T3 to L1 or L2, that's a big fusion. That's many levels of the spine that are fused. Why aren't those being referred for physical therapy? I think adults with scoliosis correction surgery are referred for physical therapy more often, but adolescents who have scoliosis correction and kyphosis correction surgeries aren't referred because most of them do just fine, or they don't seem to have the complications, or they recover faster because they're younger and their tissues are more recoverable, for lack of a better word. So thinking about that, I think one other thing in talking to surgeons why that is the case, that they don't refer for physical therapy, is they don't know if the physical therapist who's working with that person is going to overdo it with them. A lot of PTs don't know what to do with large fusions of the spine. I get asked all the time if a scoliosis fusion is the most complex thing that I've seen, and it's not. We see all kinds of complex surgeries and things like that for the spine. But what's interesting is there are a lot of PTs that don't ever see this. They don't really see big scoliosis curves. They don't know how to deal with post-operatively an adolescent who has scoliosis or kyphosis correction surgery. So with that in mind, I went around to 5 different surgeons in our area, and I talked to them specifically about what they would want in a protocol that is to be used after scoliosis and kyphosis correction. And what was interesting is most of them agreed on the basics, but it was the finer details of the protocol that really got tricky to create one protocol that worked for all surgeons. But I think we got pretty good. We've talked to many surgeons and had them look at and give us feedback on the protocol. So I'll put a link to our protocol. You can download it from our website and you can use that protocol. Keep in mind that this may not be the protocol that is used by your surgeon. So talk to your surgeon, make sure this protocol is correct and appropriate for you, because there are different surgical techniques. There are different ways that surgery is done. But for the surgeons in Utah, that's the protocol we came up with. It's fair, it's not way conservative, but it also is not an aggressive protocol. So with that protocol, it starts with 0 to 8 weeks, where it talks about what we're doing specific to activating the core muscles, watching your posture, things like that. It goes from 8 to 3 months, where it talks about increasing activity. And then it goes from 3 months to 6 months, talking about what you should do there, and 6 months to a year. Talks about what to avoid during those times and what to do during those times. Learning what to avoid is important. You don't want to twist the spine. We don't want to bend, lift, and twist in the early stages. But what are the things that you should be doing? That's more what I wanted to look at. How do we get your strength back? How do we get your mobility back? So if you're someone who's had surgery for kyphosis or scoliosis, that protocol may be something that's of interest to you. If you're someone who is looking at having surgery with kyphosis and scoliosis. It's something that you may want to look at beforehand to see what timeline and what you're going to be dealing with. This protocol is not designed for adults with scoliosis. I'll most likely be doing a different protocol for that in conjunction with other surgeons. The problem with adults with scoliosis is there's a lot more comorbidities. There's a lot of other things going on that may not be directly related to the scoliosis. Cardiovascular problems or general back pain or joint replacements, things like that can all change how a protocol for adults would be developed. So it might take us a little bit longer to figure that out, but this gives you some good guidance on what we're doing, allowing the spine to heal and fuse, and what we're wanting to avoid. Pay particular attention to what to avoid. On the webpage where you can download this protocol, it also talks about other ideas and suggestions during that time, like how to avoid infections and how to identify infections before they increase. It also has videos to show how to do the exercises on that webpage as well. So hopefully that it's helpful if you're looking for something specific that you can do after your surgery. Remember, consult with your surgeon and make sure this is appropriate for you. And hopefully it's helpful. I really want to change the narrative, or change what's normally done right now, where we are able to do rehab with our adolescent scoliosis and kyphosis correction patients. Because what I see them 2 years down the road when they haven't been able to strengthen enough, or their head's too far forward, or their scapula is clicking, or other things. I see them afterwards to fix the things that we could have addressed early on. If you're having aches and pains associated with your scoliosis correction or kyphosis correction that just is not going away, there are many things that we can do. If you have a residual curve, like a lumbar curve that wasn't corrected in the fusion, and you're noticing some changes, or you're noticing your pelvis is shifting more, there are things that we can do. That's a perfect opportunity to use the Schroth method even after a fusion to do that. We're not moving the area where the fusion is. Let's be clear on that. We're not correcting the rib hump if you have a rib hump where the fusion is. But it doesn't mean we can't increase function and strength and mobility and get you back to doing those things that you love to do. So check out our website. Again, the link is below. Check that out and look at the protocol. I'd love to hear what you think about it. And don't forget to subscribe. I appreciate you watching this video, and hopefully we can help you in the future as well. Thanks.